Just in case we've had anybody new join in, I see we're gathering a couple participants. We are actually giving folks time to trickle in before we start with introductions and the rest. So thank you all for your patience.
Lauren, your voice was again a little bit like corrupted. Is your microphone really loud, or is it just the feedback or the echo?
Well, that is something we can try out. I don't typically use my headphones here because that's usually what creates the worst quality.
Okay.
But if I am breaking up, please let me know.
Okay, yes. And actually now you are a little bit closer to your laptop. It's better. Maybe it's just maybe if you just turn your head, it made the trick. So a little
you all can really get to know me.
For the attendees, we just wait for a couple of minutes more. We will begin shortly. I see people coming in and going out. So
let us know in the chat if you are having problems or if you are needing to log in multiple times, just so we know what's going on with you all as the attendees. If it's folks just clicking in and saying,
yes,
oh, they're not talking yet, I'll be back in 5, I'll go refill my coffee, that's also completely understandable.
Yeah. more attendees dropping in, so just 1 more minute, I think. Well, okay, it's 1 p.m. CET now, so I think we'll begin this webinar. And of course, there might be many people coming in a bit late, so but they will be a little bit late, and so that's no problem. So we'll start now. Good morning, good day, good afternoon, good evening, whether your time zone might be for everyone. I'm honored to welcome you all into this webinar arranged by IFLA Public Libraries section. My name is Juha Manninen. I am the director of Finnish Library Association, and I will be the moderator for this panel. As libraries care for everyone, it's essential to have a debate on traumas that might concern both the library users and library staff, experienced in the library or maybe outside the library, but the consequences might occur inside the library. I'd like to thank Jane Cowell and Liz White of Public Libraries section as our officials, and our little working group members Paska Tarandova, Lenka Brukova, and Ellen Golden for building up this particular panel. Ellen will also be the technician for this webinar. And we have some difficulties so far with the speakers, as we are waiting for April Hobbs, Abby Bricker, and Filey Tukivner to join. And I also have to apologize that we have one major change in today's program. There is a wide public sector strike going on this very moment in Finland, including librarians in 10 of our biggest towns. So our last speaker, Mrs. Mervi Vaara from Oulu City Library, Finland, is not present with us today. I hope she can send her presentation to us later so we can share it among the participants of this webinar. Despite of this one absence, however, I could instead encourage you all to discuss our topics of the day and place questions to speakers after their presentations. And we have now here already Ms. Lauren Gambrill, the research coordinator from Information School at University of Washington. And the presentation is named Trauma in the Library, Findings to Date about PTSD among Public Library Staff and Methods for Ensuring Trauma-Informed Care. So I will now mute myself and give Lauren the possibility to speak. So you're welcome, Lauren.
Excellent. And just to make sure before I start sharing the screen, am I all good as far as hearing me? Thumbs up. Can you hear me all right? Okay, perfect. So welcome everyone. I am presenting on behalf of myself and Karen Fisher for our Trauma in the Library study. We have been doing this for the last about year and a half. It is IMLS Institute of Museum and Library Services funded. So it does focus a lot on the US right now. It is something that we are open to potentially exploring more in the future on the international implications and if it would be possible to widen the study, because everyone, as we could tell from the protest this morning, is going through something in their own country, and it definitely has a wider implication for everything that's going on with libraries and the vital services that they provide no matter where you are. Dr. Fisher herself is traveling in between Canada and Jordan for her ongoing work with libraries in refugee camps, which is why she may not be able to log on right now because of wonderful travel issues, but she is passionate about it, and I do have some of her research on the back burner that I can at least take questions for and hopefully get that information back to you, other than talking about the trauma in the library study, which is what I run directly. Moving forward a little bit, special thanks to our advisory committee. We do make sure that we are talking to people who have different backgrounds with different emphases. Again, it is US focused at this point in time, but we wouldn't be able to have such an extensive questionnaire or as great of a view in depth to where different people are coming from without their help. So we're grateful to them. This is our wonderful word wall, just taking the qualitative responses on what people talk about and the stress that is from a lot of these origins or things that have caused it. So we were able to take actual qualitative responses and build this up from our initial survey, which I will be explaining in just a moment. But I think some of these things will feel unfortunately familiar to you all, but it is something that's worthwhile to talk about so we can focus on solutions moving forward. The goals of this particular study is, as mentioned, looking into if US library staff have a higher incidence rate of post-traumatic stress disorder due to work incidents, how prevalent this is, and what are the current gaps in library support for these employees. We have actually over 1,000 participants who have done stage 1 in the initial survey that is still open. We can send you those links. It is a relatively short quantitative and qualitative survey that goes through and asks what people have experienced so far, some basic demographic questions, and we are going to be doing a further examination when we're getting ready for publishing to go through and make connections on where people are facing the most difficulties in the US and how that relates to the ongoing narrative. Okay, and just making sure I wasn't missing anyone in the chat there. If I am missing a question in the chat, feel free to ask it out loud, my fellow moderator, if just in case I do not see it. The stage 2 paid interviews are ongoing, where we are selecting a few interested folks who have done that first study and going through a semi-structured, trauma-focused, exploratory disclosure that they are able to have with me, and going through a particular incident at the workplace more in depth and the fallout from that for them personally and their opinions on the systemic changes in the system that they would like to see, and sort of bringing all of that together as support of the stage 1, but also just its own section of the study that gets us more depth into talking with these individuals. And then stage 3, we are in, again, the preliminary presentations for you all now, but we are happy to be here, and I'm happy to share some of our initial results, mostly from stage 1 at this point. Where our current respondents are employed at, mostly public libraries in the US, mine. So this is out of the 1,000+ participants, because this was updated more recently. The academic field has a showing. We appreciate you all. Schools like special and other were less represented, but that is to be expected as well. A lot of our reports were the urban central, which is its own sort of definition that people agreed upon out here. But we are looking more in depth to get rural responses from our First Nations people areas where they have very specific types of libraries and cultural knowledge that's maintained there, to see if there are any differences. And we're also focused on trying to increase involvement from folks of different identities to make sure that we are getting an accurate representation of what it looks like for different library staff in the US, whether that be where they work, who's working there, or how it is affecting them over a longitudinal point in time. Because most of our respondents have been frontline service workers who work full time. We do have a number of admins reporting in as well, and we have gotten some interesting responses from security teams, given that we are talking about trauma, but it is just another interesting demographic to have. Currently, as far as additional interesting statistics, we do have a number of LGBTQI respondents, and we do have over 15% of our respondents of 1,000 people who are unsure of what their employee benefits are in regards to trauma and in general. And 10% of them said that they did not have access through work to that type of employee benefit. And most of the folks reporting in have, or over half rather, have many years of experience. So these aren't people who are coming in off of internships and don't know what they're talking about. One other main part is we are trying to look and explore in this first study if you have existing health complications, disability statuses, or identities that put you more at risk. How has that impacted your experience of trauma, your likelihood of trauma, and your response through these peri-traumatic events, which I'll talk a little bit more in depth on. So as you can see, we've got a whole lot of respondents who are dealing with anxiety and depression, and it would be remiss of me not to talk about the fact that there are troubling times in the world, and that does sometimes have mediating effect that we're going to be looking into and justifying when we're doing the full write-up, as far as people presenting with more anxiety or depression through a pandemic. So that will be mentioned, but it is not written yet. When we're talking about these topics again, people going through having a disability status and working on that in the employment, we've had folks report back that they've had difficulty accessing benefits directly, as well as having people in the libraries make it harder on them as staff due to these sorts of things, as well as visible gender identity or sexual orientation differences, the unfortunate race and ethnicity biases that they experience from both internal and participant involvement, other traumatic events and how that pairs and builds onto a peri-traumatic response for a workplace incident, and other areas of chronic stress and trauma. So these particular discriminatory or personality or individual identity aspects have a compounding effect when put into chronic stress exposure and in situations where they are exposed to different types of trauma and stress without any remediation or help or assistance from the workplace. And our numbers from the survey follow and pair up with other surveys that have said the same thing, but not specific to workplaces and certainly not specific to libraries. This is just another way to show that to you in case those numbers are more compelling give you that count on the end. So if they have felt that these aspects of their lived experience have heightened their ability to identify their amount that they are impacted by, or their general ability to cope with further trauma, these folks have identified that it has made it harder for them. And that is something that we are following up on in the second stage with these folks in particular. Now, this is one that requires a little more unpacking. Our measure that we built for this study goes through and asks if you have dealt with these things directly or has happened to you, if you witnessed it in your workplace, if you learned about it, heard about it happening in your workplace, but it may not have been something you dealt with directly, if you're not sure about it, or if it does not apply. And this is our list of different things we've asked, from verbal abuse to a sudden death of a coworker in the workplace, or dealing with a violent death or homicide, and then something like stressor lawsuits taken against staff or something else that worries to them. Now, when we are asking this, we are just saying if any of these events happen to you, not the amount of times that folks are dealing with verbal abuse, etc. So just in one instance of any of these events, we have over 3,500 traumatic incidences that they have said happens to them. Not how often it happens to them, but that they have experienced this type of thing directly. We put together these questions by looking through many articles and many message boards through the US, as well as talking to, of course, our wonderful consultants about the themes of trauma and stress that they are dealing with. We also ended up putting in a COVID measure after the fact. Thank you, IRB, for letting us do that, but those numbers will come up a little bit later for COVID-specific stressors. But building off of this, we found it very compelling that so many people have dealt with so much stress directly, and that the secondary trauma of dealing with patrons' concerns, as well as their coworkers' concerns, as well as their own, creates an environment that does not have enough support to help them prevent burnout, to prevent re-traumatization, or to adequately support those who are going through difficult times outside of the workplace and then have to deal with this within the workplace. And I'm happy to go back to this slide or let you all read more later on, but this is just another way to show you some of our more compelling numbers. So many people are experiencing that verbal abuse, that burnout. Sexual harassment, of course, has a wide array of how that can present itself, but it was very prevalent amongst their experiences. Destruction of property, theft, physical assaults, life-threatening injuries, active shooters, sexual assault, and more. The fact that we have such a relatively small sampling to those who actually work in libraries just across the US, even if it's over 1,000 people, that is still a drop in the water. And we have this many incidences and this high of a percentage rate for folks responding is evidence enough that we need more support and more EAP benefits that are focused on dealing with this type of thing. We talked a little bit, or I mentioned earlier, about the longitudinal side of when these events are occurring, and the majority of them have happened within the last 2 to 5 years. Again, if most of the people who are responding have worked over 8 years in the library, but most of them have experienced recent trauma, that moves along with the chronic exposure and these are when most of these events occurred. We asked them to sort of pick a timeline. We are then worried about, of course, the time and history that we're dealing with, and that creates its own stressors, but also the fact that there might be an increasing need, not just an increasing report in these types of events happening in libraries from a number of different stressing points in the environment that is making its way into those doors. And the fact that if you have those peritraumatic responses, these are just pulled from different literature, where it's pretty normal to have all of these effects right after trauma. And if it's not dealt with, that's when it starts to lead into PTS and the actual disordered elements of trauma after the fact. But just as the PSA, if you have somebody who's experienced trauma at work or around you, that can even be something like exposure to a particularly, we do have questions in our survey about folks who have experienced work stress in their libraries due to activism or protests or riots or different things. So if those events are happening near you or to those you care about, these are a good thing to sort of check on with them to make sure they get help in advance as well, just as a current note, as well as what we're dealing with our study folks, where they could help identify these things or identify them in themselves when these events happen before it becomes an environmental stressor that puts you at further risk for PTSD when you have little support. And then you get the anxiety, when you have the returning physiological reactions, when you start to get into a similar or triggering event. And we basically want to find a way to get support into those libraries to stop this from happening. This cycle that you see over in the corner here that is leading to worse and worse outcomes and more burnout. We do also have some brief quotes from the qualitative side of things. With our COVID specific questions, they were dealing with a lot. And I won't spend too much time reading every word of these, but know that this is a very small sampling of what we were dealing with in these qualitative surveys overall, and that many have similar stories. So this one was more COVID specific as far as people coming in and reporting doing awful things in the library and harassing staff and feeling worried about their personal safety to the point of leaving that particular library. We have folks who are reporting that they have 200 incidences in a year involving direct threats or physical harm to staff. We have folks who are very open in the fact that they are struggling with complex PTSD and that working in this type of environment within the libraries that they love has made their PTSD worse. And in the fact that we do have a little section here above that talks about protests creating concerns and cutting in programs causing stress. Pretty much everything that you can imagine. We've gotten a little bit of a drop of sampling on people going through it. And again, there was more on people getting yelled at and those sorts of things, which we can discuss more either in the chat or if we are able to talk when we're facilitating a longer discussion. I'm happy to do that with you. These are some of the general questions that we are asking folks when we are presenting. So if anybody has something that they want to put in the chat, I will attempt to respond to that momentarily. I'm trying to think of the best way to share that where I can also answer, since I don't think a lot of you have the ability to speak right now, but just in wrapping up, tell me if you think that we are missing anything except for that international component, which we will be advocating for. Does this sound like what you guys are dealing with in your libraries? And do you think that folks where you are need more support as well? So I will wrap up here, and I thank you all for letting me speak.
Well, thank you so much, Lauren. It was an interesting survey, and you're doing a great job finding out this helping the whole library community with your work. As I want to tell to those participants that came up a little bit later, we only have 2 speeches today. So if you now have questions, please feel free to place questions to Lauren in the chat or raising your hand. You're welcome. I also like to welcome Ms. Filey Kiefner and April Hubbs for the next speakers.
I also welcome comments. If any of you want to comment on the current study, if you've got an opinion, but not necessarily a question, you all want to type it in the chat or say it out loud. But mostly, again, I want to thank you for facilitating and for allowing me to speak.
Good point. There's one question from Lenka.
Thank you.
You're welcome.
Thank you. I am very happy to can listen to your very interesting survey, and I want to ask some question about the people who was in the survey. Can you recommend them some help or some special care after these problems by COVID and by this trauma?
That is a great question. So yes, we don't just ask people about their trauma and let them go about their day. I was hired for this specifically because I have trauma training, and that's my background, is actually more of the psychological and trauma focused field. So we actually have an entire list of resources that are US specific, because that's where our study is at the moment, but of emergency hotlines, just in case it triggers something for them, of ways to get discounted or sliding scale therapy that is cross-country and specific to them, where they can narrow it down with SAMHSA and some different organizations and other methods of support. So we've got an entire list that they have access to as soon as they take the survey, and it's also on our main website page, just with the most general of information where they can get help. Even if it's not all pro bono, it's as accessible as we have been able to find and verify for them.
Thank you very much.
Thank you for the question.
Yes.
And then we have a question from Filey Kiefner. You're welcome.
Hi, it's wonderful to hear these survey results. It's just very interesting. I was just thinking, did you ask the librarians, any one of them, or did you see from the finding about the pursuit of mental health support?
We are asking that more in the second survey than the first, about how they've gotten help for themselves, if it's been supported through the workplace or if it is something that they've had to venture out and seek on their own. It is, again, a really great question. In the first survey, we were focused more on the demographics and the incidence rates and what types of trauma they were experiencing the most and where. We just didn't have that question built into that particular survey, but we have been asking that in the second round to verify how they've been able to seek help and what's actually worked for them. We actually end those surveys on those hopeful notes on what they hope will change for their career, why they're still in it, and what's been effective in helping them cope with what they've been dealing with. So, you know, always end on a happy note if you can.
Thank you very much.
Thank you. Any more comments or questions for Lauren? You may also place your questions or comments afterwards, later after the next speech. So I'd like to welcome April Hubbs and Abby Bricker and Filey Kiefner from South Carolina. University of South Carolina and Charleston County Public Library. April is from there. Welcome. And the topic of the speech is crises may be just the opportunities for transformations. How public libraries have been serving their user communities since the pandemic hit the United States. So the stage is open for you. Welcome.
All right, good day. So let me share our PowerPoint. Sorry about that. We were a little bit late to join the session. It's just because there's some time mistakes here. Good day, everybody. It is such an honor and a great pleasure for us to meet you in the virtual world. My name is Feli Kiefner. I am an associate professor at the School of Information Science at the University of South Carolina. Now, our team members will introduce themselves.
Hi, I'm Abby Ricker. I'm a registered nurse and a master's student at the University of South Carolina.
Hi, my name is April Hobbs, and I am a public librarian in South Carolina.
Our presentation has 3 parts. First, April will talk about the innovative services provided by public libraries during the pandemic. Then April and Abby will present a content analytical study examining readability level of COVID-19 consumer health information available for the adult access published by the US CDC and the World Health Organization. Finally, I will discuss the required knowledge, skill sets, and the leadership qualifications identified from 3 situation-specific studies examining disaster information, dissemination, and services provided by public libraries in times of crisis. So I'm going to give the microphone to April now.
During the pandemic, public libraries learned to adapt and provide their services and materials in new, interesting ways, in addition to adding specific services that cater to the needs of their communities that were affected by COVID-19. We would like to discuss some of these additional services. When public libraries started phasing back open, they did so by providing curbside services and quarantining books. For example, Lexington, Kershaw, and Sumter County libraries in South Carolina had outdoor contactless pickup for patrons to check out books. Other libraries had similar services in addition to expanding their online services. Partnerships with local health departments to use the library as vaccination centers increased in 2021 because libraries are usually open 7 days a week, typically wheelchair accessible, and include safety features such as security cameras. Recently, the Public Library of Mount Vernon in Knox County in Ohio was granted over $37,000 by Communities for Immunity, which is supported by the Association of Science and Technology Centers in collaboration with the Centers for Disease Control and the Institute of Museum and Library Services. This program aims to support libraries and museums in areas with residents who mistrust a vaccine, with programs ranging from vaccination clinics to educational workshops on the efficacy of the vaccine. Vaccine clinics have continued this year as the New York Public Library System offered vaccines for children ages 5 to 11 through a partnership with New York City Test and Trace Corps. They had 16 branches in total that had pop-up vaccination clinics that ran until February 2022. The library systems that participated included Brooklyn Public Library, the New York Public Library, and Queens Public Library. King County Library System in the state of Washington partnered with Public Health Seattle and King County to provide single and 2-dose vaccine shots for ages 5 and older starting February 1st, 2022. They also have booster shots available in addition to medical staff and interpreter services. DC libraries in recent months have become distribution centers for coronavirus test kits. In partnership with DC Health, staff from DC Health distribute rapid tests at 9 library branches, while librarians distribute PCR tests at other branches. The state of Michigan has also partnered with 18 libraries across the state to distribute COVID test kits as part of a pilot project for vulnerable communities. The Virginia's Department of Health has implemented a similar partnership with libraries across the state of Virginia, with 18 library systems distributing COVID at-home test kits, and it has increased to 60 library systems as of January 2022. In addition to COVID test kits and COVID vaccination clinics, libraries added more specific services to address needs during COVID. For example, Maine State Library has established a Libraries Health Connect program. This program provides the technology, space, and equipment needed for telehealth services through the public library within 10 rural area communities. It was started in response to the community concerns library staff were hearing during COVID about the difficulty of receiving healthcare services in some parts of the state. Libraries also use their makerspaces to 3D print personal protective equipment. Libraries have adapted their previously established services and programs in a more mobile option, like Manitowoc Public Library in Wisconsin, who took their Storytime on the road through community partnerships with the local art museum, Lincoln Park Zoo, and others. Now, we would like to share with you our study on COVID-19 consumer health information and access. The focus of the study is to analyze the readability levels of COVID-19 consumer health information available for adult access. This research examined whether essential consumer health information resources on the pandemic can be easily used by adults in the general public for evidence-based problem solving.
In this study, we sought to answer the question, given that the American Medical Association recommends a 6th grade reading level for health publications, do the CDC and WHO publications meet the recommendation as shown by their Flesch-Kincaid grade level scores? We follow theoretical frameworks like Salovenen's Everyday Life Seeking Information and Durbin's Sense-Making Model to explore how well resources can be understood and utilized by the audience. Specifically, this study utilizes content and document analysis to examine to examine the levels of readability of COVID-19 health information distributed by the CDC and WHO. As 2 internationally renowned authoritative health information services, we expected the CDC and WHO resources to be accessible and heavily shared by libraries. The sample populations analyzed or identified through accessing the COVID-19 health information shared on the public library system websites of the 20 largest US cities. The libraries struck out in this chart were not included in the study as they did not include COVID-19 health information links on their websites. The team had to suspend sampling from the San Diego Public Library, which is highlighted in green, after an incident occurred during data collection. So the data we collected on them is also not included in the sample size. CDC and WHO samples were collected from the remaining libraries, which are highlighted in garnet. Now I'll get into what we actually learned in our study. We had a total of 907 links after removing duplicates, dead or missing links, and documents that did not meet the inclusion criteria for analysis. For the current study, the scores of documents published by both CDC and WHO were analyzed for reporting. Out of the total sample size of 907, 148 or 16.3% of links were either CDC or WHO. Of those, 121 or 81.8% were from the CDC and 27 or 18.2% were from WHO. On average, the CDC samples had an 11.4 Flesch-Kincaid score, while the average for the WHO was 10.2. Note the significant standard deviations throughout the sampling. Only, can you just click so that the chart goes up for me? Thanks. Only 2 samples from the CDC had below a 6th grade reading level. 41 or 33.9% of the CDC samples fell between 6 and 10, and the remaining 78 or 64.5% scored greater than 10. None of the WHO samples had below a 6th grade reading level. 5 or 18.5% fell between 6 and 10, and the remaining 22 of the samples fell, which was 81.5%, scored greater than 10. It's important to remember that our sampling was not conducted by directly accessing either the CDC or WHO websites. Samples were collected through links shared by public libraries. Therefore, the sample size, especially in regard to documents from the World Health Organization, is small. Oh, Dr. Tukiefner, you're muted. Oh, I'm sorry.
Sorry, well, you go ahead and finish this.
Sorry about that. It looks like we just skipped a slide. Of the combined CDC and WHO samples, the document with the highest Flesch-Kincaid score was a document on wearing masks. It had a score of 18.9. The highest scoring document from the World Health Organization at 18.0 was about COVID-19 virus and disease. Interestingly, the lowest scoring WHO document was also about wearing masks. It had a Flesch-Kincaid score of 7.5, and the lowest scoring CDC sample at a reading grade level of 5.5 was about COVID-19 tests and testing. Based on the Flesch-Kincaid scores in this study, our conclusion is that no, the CDC and World Health publications do not meet the American Medical Association recommendations for consumer health information at or below a 6th grade reading level. Thanks, Dr. Tu.
As the PI of the study, and I have to edit some comments at the end, since we do have a little bit more time. I think that we all feel that after pandemic, librarians, particularly information professionals, public librarians, have been fighting both pandemic and an infodemic. We believe that the most important things that we wanted to point out is that one important thing, if we wanted to fight the infodemic, is to provide the information makes sense, can be understood, can be used easily by people. However, based on our study, I feel like, and maybe we all feel like it's a little disappointing to see the COVID-19 consumer health information is at such a high readability level. Okay, particularly the CDC's documents on how to make a cloth mask fit very tightly may end up scoring at 18th grade level, almost 19. How can people understand that easily? And that is the question that we all needed to ask ourselves. The highest score of the documents published by WHO is about the COVID-19 variant. So I think that public librarians, particularly public librarians, really needed to consider making the selection of information can be understood by people easily. And also, one thing that I hope that the public librarians would consider doing later is to provide multimedia, use like videos, audios, podcasts to complement with the selection of authoritative consumer health information online. Another thing is that perhaps public libraries will need to start to advocate having lower readability levels of consumer health information on various topics for the general public. So now this is just a little bit add-on comments on this portion of our research project. Now, I would like to talk about the final portions, and I will present 3 research studies showcasing how public libraries and librarians provide a community-first disaster information services in times of crisis. The focus will be on the knowledge, skill sets, and the leadership qualification I identified from our results. Since 2015, 3 situation-specific studies examining disaster information dissemination and services provided by public libraries have been conducted by our teams. In October 2015, several counties in the central part of South Carolina experienced catastrophic flooding that caused severe damages, including loss of homes and other destruction. Almost the same days in October 2016, Hurricane Matthew hit the coastal zone of South Carolina, causing both winds and water damage. And again, it caused losses in the community. Then Hurricane Harvey hit Houston. It starts on August 25, 2017, and went through the September 1st, 2017. Our team conducted the study in 2015. We held focus group meetings with librarians who were instrumental in providing services before, during, and after the services, right after the disaster, right after the flooding. In 2017, we conducted a survey studies. We studied community members' use of public library services and in the informations during and after the hurricane hit the coastal zone of South Carolina. That was a year after. That was a year after Matthew hit the coastal zone. It just because we chose not to do the survey right after the disaster, because people may not have the time and energy to answer the question. We went to Houston to conduct the focus group meeting 1 year after Harvey hit Houston, Texas. We chose that time just because Hurricane Harvey hit Houston severely. There is no way that librarians could host these types of on-site study right after the disaster. Our team documented the public libraries' value to their community and their legitimacy as partners of multi-leveled agencies from different sectors. Our intention was to examine and document the dynamic phenomena related to the libraries and and their social responsibilities in times of disaster. As an information scientist and an educator, I recognize that librarians are among the first responder active in times of crisis. In these 3 studies, our teams have identified professional librarians required leadership qualifications, as well as the knowledge, skills, and the competencies needed in the provision of community first disaster information services. And please see the information on this slide. It is critical that LIS education programs enhance their curricula to cover the required qualification and the competencies we are showing here. One thing that I have to say that the majority of the competencies we identified have been integrated into the curriculum at the School of Information Science at the University of South Carolina. Through our 3 studies, we identified these top 6 tips for librarians regarding advocacy and the community engagement. I would like to say, particularly, okay, I am wearing my educator's hat now. I would like to say that librarians really needed to believe that they are leaders. Librarians needed to believe in themselves and to believe that they must take a leadership role in community advocacy and engagement, and to practice it in daily operations. You can do it. And I hope that these 6 tips will be useful for your daily operations. This is the end of our presentation. Please find our contact information on the screen if you wanted to contact us later with questions or comments. And thank you very much. We do have several publications based on our studies. So if you are interested in learning more about study, please contact me and I am able to email you some of the citations. Thank you.
Thank you so much for your presentation. I'd like to add that we actually have plenty of time. As I told earlier, for those who weren't present in the beginning of the session, I have to apologize that we have a change in program because there's a wide public sector strike going on this moment in Finland. So we won't have the third speech as including librarians of 10 our biggest towns are now on strike. So we have plenty of time for questions and comments. At first, I'd like to thank you both of these presentations and make an example from Finland. In March 2020, all libraries were totally closed here. Not even this book pickup was allowed as it was in your examples. And in libraries, for libraries and librarians, some city councils laid off the staff for 11 weeks. Some didn't. So those libraries that still operated mainly online during this 11-week total lockdown. They built up more online services, book talk in Instagram, TikTok, Facebook, and so on. And as you said, Feili, that it's essential for libraries to make information understandable. That's the whole point. And I think online services can help in this making science understandable for common people is a essential question. And then during this, let's say, for more than 1 year, we have used masks here in Finland. In libraries, we have had some difficulties with people who wouldn't wear a mask despite the strong recommendations. In Finland, it was not mandatory, and using library is a fundamental right, so we couldn't force people to wear masks. And then some library users not wearing masks, they acted aggressively for the ones that used, or for the restrictions in general, as we have like in major cities, it was like allowed to use the library for 15 minutes at the time and so on. So thank you so much for your presentations, and I'll now ask for more comments, and please, you're welcome.
I saw one of the comments from about the skills the librarians needed to show in times of crisis. Yes, I think those are the things, and I am glad that we identified. And I have to say that not many librarians feel like they wanted to have coursework about disaster information services when they were in the education program. That's out of our surprise. We feel like they really wanted to have all of these skills with them. However, so that's why we kind of shifted the ideas of, we still integrate them into the curriculum. Of course, just blended in the different coursework. But one thing we did is, since one of the studies, well, 2 of our studies were partnered with the South Carolina State Library. So we're able to use our findings to integrate them into the professional development program. So librarians can actually get some of these skills through continuing educations, professional development webinar and workshops, etc. So I think that it is really important for us to push the ideas to help librarians understand that those are essential. We all needed to prepare in advance. Disasters hit us at any time. You know, like South Carolina is in the coastal zone on the East Coast of the United States. We got a hurricane hit every single year. It's not like it's unusual we got flooded. One of our study sites and it got flooded 3 times. So in 2 years. So one thing that I would like to ask our international participants over here, please, if you want our PowerPoint slides, please email me and I am provided, and I can provide these to you, and make sure that you will use some of our findings to share them with your colleagues. Okay, Okay, so it's Adriana's comments. So after the pandemic, I believe that skills needed to change forever. Well, yes, particularly how to identify the easy to understand health information for people who can understand it and use it. That's definitely very essential. And also, and I think librarians really needed to show some leadership qualification here. Librarians can demand the public health agencies, please provide us something that we can help our community members. I think that's important. If people don't understand it, how can they use it? And why this pandemic advanced so much about the distrust of science? A part of the reason is people feel vulnerable. People feel uncertain. COVID-19 virus is relatively unknown to us 2+ years ago. And we cannot blame people feel vulnerable. We cannot do that. However, we also needed to see it's so important. It's so important we help people develop health literacy skills and health information skills. You know, those skills can be educated by librarians to the community members. Librarians can do better than a lot of people. And that's, of course, that's my personal opinion. And one thing, okay, I am going to shamelessly say these over here. I am interested in studying public librarians' services to refugees after the war. So if any librarians and would like to collaborate with me, please contact me. You can find my email address on our slide. Please email me.
Thank you, Faili. Great closer. So far, we all have, at least I have, increased the awareness of dealing with topics that were not the first ones crossing our minds when we were studying to be library professionals. So I think the topic of this webinar was both relevant and both mind-opening. So thank you all. Any more questions or comments? Lauren. Oh, sorry. Or Lenka. Lenka, please go ahead. Lenka, you're welcome, but you're muted now.
Yeah. Once more, thank you. Once more. I admire American libraries to offer their buildings for vaccination centers. Yeah, because it must be very big libraries which offers this. And I want to ask you that it is mandatory for people in libraries to be vaccinated or not.
April, please.
So speaking from experience from my library system, we librarians in my library system, we were asked to be vaccinated, but unless you had like a religious exemption or something similar, you were allowed to have a pass, but you had to get tested once a week. That was the rules that we had. And I think that has sunset now. But like about 90 to 95% of my staff members in my county for my whole county government employees, including the library, there's about like 95% of employees that have been vaccinated. So that's been good. And it definitely relieves some members of the public that were a little apprehensive about coming back into the library. But with the vaccination centers, definitely, they were chosen by the county where I am. And most of the time it was just making sure that they were accessible to people that had wheelchairs and that had a hard time getting around. And when we first did it, it was serving older populations and stuff like that. So I helped out with the vaccination centers at my branch back in February and March of 2021. And my library branch it's a decent size. It's a pretty big size. We use our community rooms for the vaccination clinics, and the lobby area was more of a waiting area and like for filling out paperwork too. So we had like different stations for everything. But most of the time it was at these larger libraries within county systems, and a lot of main branches too. When I was doing this research, it was a lot of main branches doing it and other branches. And also the rural communities had libraries that did it too. And so it's been really interesting to see like how people pick these libraries for vaccination centers and stuff like that. Because libraries are community centers for their community, it just makes sense to use them as a vaccination center since people use them so much. And it's been a really good partnership for libraries too. So.
Thank you.
I'd actually like to second April on that. I'm actually on the other coast of the US, so around the Seattle area, but we've had a lot of luck utilizing and leveraging both the urban and the rural libraries, so they don't necessarily have to be big to be involved. A lot of our urban settings are where folks already go if they need to print an application for work or even just get out of the cold in the colder months. So we have a large homeless population that will utilize library systems for a lot of different reasons, including just hygiene. So there's already connections that they have with a smattering of the local population and those in need. And then for the more rural areas, let's say in Washington State, we do have a lot of libraries that are already linked with different public services and public health services that predate the pandemic. A lot of them, for example, are used in conjunction with Medicare to help pass out hearing aid batteries and those sort of functional things because it's a central location where they can meet up at. So there is precedent for it, but there is no agreement across states. But it definitely shows that our wonderful librarians need to be prepared for anything and that they wear a lot of different hats to serve their communities, and that it's just a resilient community overall.
And we have here some comments in the chat. Ismena wishes to thank everyone, to all presenters, very interesting researches. And Adriana stated that after the pandemic, she believed that the skills need to change forever. That's true. We need librarians who are proactive and make the difference in their communities. And then Hannah says that in Germany, several libraries also functioned as vaccination centers, but it's not mandatory to be vaccinated as staff, as there is no such law to base the request on. Pretty much the same here. And then there's a comment from Eileen. I agree that it's so important that librarians adequately influence the readability levels of health information. But what methods can we use to ensure that health literacy is given the attention that is needed in wider society?
Okay.
Anyone wishes to answer this?
Yes, I would like to address a little bit about these and throughout our findings. And of course, I thought a whole lot of things about this. First, that's one thing is.
If you or a loved one is fighting time.
Now, I have to say that we did, and we basically talked about 4 studies in our presentation. For the 3 studies about the disaster health information services study, we found out that public libraries really need to have good partnership with multi-level agencies. It doesn't matter it's government, it doesn't matter it's local community, it doesn't matter anything else, okay? It is important for us to address these. If the libraries have such a kind of partnership, long-term partnership, they can reflect the community members' needs to those agencies. And of course, that's through evidence, like public libraries can do some of the things we did it to do the content analysis. We did not use any professional tools. What we did is we use Microsoft Word. We run the documents and find the grade level. And so you can show the evidence to the agency. Here's what we found. And we got some response from the local community member. They don't understand it. Could you, okay, and help us with that? Another thing, and I mentioned that earlier, and I really hope that public libraries should start as use multimedia to deliver health information the services. So here is an example. And I actually mentioned that to my team member. So I'm going to wear my public librarian's hat now, suppose, okay? Every community is different. We cannot use one formula, one size to fit every different community. So every local public libraries may think of how to choose the resources and develop type of services for their communities. So if I were a public librarian, when the time comes, I would contact local public health agencies. So started with find a public health expert and start to do the dialogue. Okay, podcast every week. So what kind of, and use the multimedia, use these kind of more podcast way, and not just use text-based, use narration, use voice, use audio recording to influence the understanding of community member. Of course, these type of multimedia, it doesn't matter, it's a recording, it's a video, it's just a podcast dialogue, interviews can really help people better understand the situation. So they will not do any wild guess in their mind to run all the little theaters. Oh my God, it's COVID, it's whatever. What if I got, what if? And people will not try to find and do the wild hunt on the internet to find those things with mistakes. So, and I think that the better way is to be more active. So we will start to have the public health dialogue programs every week, 5 minutes, 10 minutes, and talking about the community's situation and to give people some understanding about this is a virus. This virus is similar to that, may cause certain symptoms, but don't panic. Let's use certain ways okay? Then use very simple language to translate the evidence we know for now. Why for now? Have we learned these for so many, for so long that COVID has been a vast and a fast changing virus? Evidence for now can be different, can be not valid next day. So we needed to educate our community better, that we all need to deal with this in long term. We all need to have an open-minded idea, and fundamentally, we needed to have a better understand the science and the health literacy levels of the communities. Every health message can be useful. It must be delivered by the right people. We must have the right messages. We must be done at the right place and at the right time. So what I hope is we all needed to put our ideas together. And maybe IFLA is just a wonderful platform to have international members to work together and thinking about how we can develop guidelines to help public libraries to follow through these studies. We have a lot of results, and I definitely feel that our teams can support the develop such a types of guidelines. So, and I hope that, and we would have chance to work with international colleagues to develop such types of documents. And I think that we all on the same boat. We all need to support one another. That's just my idea.
Thank you. Any more questions or comments? It just crossed my mind that speaking of spreading understandable information to public, it might vary a bit depending the country you are living in. Like for example, the role of national radio broadcasting company in Finland is quite huge. It's people trust the national radio broadcasting company, and it's respected. Even those who don't like to pay taxes, they get their information from the YLE, which is the name of the broadcasting company, and they have had a really big role in let's say this COVID information spreading. So it might vary where you live.
Lauren makes some comments on the 5C. Yes, that's just absolutely spot on. And particularly about the cultural sensitive. And I think that there is it's actually for a long time, and a while ago, I attended a webinar, and it's about public health communications. One of the scholars and the researchers talked about his work with local barbershops. So he took the public health experts to barbershops to talk to their community members, and their idea is one shot to the arm at once. So if we can use that kind of mentality, if we can influence one person That will be good. When in 2015, after the flooding in our community, our federal emergency management agency stationed in public libraries to help people to file online claims for the disaster reimbursement. And we interviewed the agency's the manager stationed in the public libraries. He told us that public libraries are perfect places. It's just because people came to libraries to use services. So people got to know FEMA, federal emergency agencies, agents there because they went to libraries. They never even thought that they could contact the federal agency. And a lot of community members actually still don't have computer and technologies at home. They count on public libraries to use technology. And some of them had troubles to file online claim form. So public librarians were there to support the technology troubleshooting. So all of these, I have to say that the public libraries are absolutely more and more important these days in our world. And one thing, and I have to say, is the last frontier. It's the last frontier for the general public to get free knowledge filtering and the technology access. Is the last place. So public libraries are for everyone in the community. So that's the reason we needed to better equip public librarians, knowledge, skills, competency, and the leadership qualifications, because they must be the advocates. They must take the leadership roles for their community members.
Thank you for such noble words. I think we have come to an end of this webinar now. So I have a couple of minutes, but in case no one wishes to place any comments or ask anything, I think I'll thank you all, our wonderful speakers. Thank you all participants, and also thank you Public Libraries section, and hope to meet you all in the future. Thank you so much for attending this webinar, and of course you can give feedback to us Public Library section members if there's something we can do better, or something to that would be done otherwise, and so on. So I think at least Lauren wants to go to sleep now. So thank you all, and have a nice day and take care of yourself.
I will attend the IFLA in Ireland, and I hope to see some of you there. Okay, see you then. Thank you.
Bye-bye.
Okay, bye-bye.
Bye-bye. Thank you.